Well, actually, stem cells have just been the research and just what's been out there about them. It's always been amazing and intriguing to me as far as the research and what's done. Is I began to hear more about what stem cells were and learn about those in my own education but what really has brought me around to using them and defining them as a tool for my patients. My father and I both have been studying stem cells for quite some time. And my father was looking at having to get knee replacement. We were talking about trying to do alternative therapies to try and keep him from having to get stem cell therapy. And
Right.
He's an alternative medicine specialist as well. So we've been conversing back and forth, both doing research into different things. And we use some other therapies here, laser therapy and some of these other things that are regenerative in their nature. And we were just looking to try and find a way to help him. And stem cells kept on coming up. It was one of the big topics that kept coming up. We kept visiting about it, kept talking about it. It was interesting. There was a lot of different stances as far as what different people were saying about how effective it was and where the FDA stood on the ability to do it in the United States and everything like that. And so we finally got the opportunity. After doing the research, we determined that the regenerative medicine process, and especially stem cell therapy, was just going to be the best choice for him if we're trying to avoid surgery. And that's really ultimately what we're trying to do, was avoid surgery. He was, he lettered in 5 different sports in college, in high school, and played not professional, but college baseball. Had the opportunity to play professional baseball, just worn his knees out over the years.
Wow.
And so we had to find something, but he didn't want to do surgery, didn't want to have to do a knee replacement from a lot of the risks. And so that's why so many patients end up coming to us anyway. But so we actually did stem cell injections and regenerative therapy for his knees, and they responded fantastic. He's kind of funny. He'll show patients, he'll jump up and down on his knees and say, "See, they're doing so much better."
Wow.
It's been a complete turnaround for him. And he's back exercising every day and staying relaxed, running the stairs and everything. Those are things he's always done for years, which is why they got worn out in the first place. But he's back doing all that now. And so it's exciting and just seeing that. We both were kind of looking into that, but seeing the response he was able to get and actually just having a personal experience with it really excited us. And so we decided to move further into it and began researching the possibility of doing it regularly for our patients, mainly for joint rehabilitation, for joint pain. That's really where our focus with the regenerative medicine and the stem cell therapy is to help to rebuild and restore the function of the joint. Not just to get people out of pain. You can medicate enough to get someone out of pain, but that doesn't mean that the function's improved. Doesn't mean they're healthier, they're better off. So we ultimately wanted to make sure the person is better quality of life. They can do what they want to do, go out and begin to enjoy life again. That's really what led us to it and got us excited about it. And the possibilities with stem cell therapy, the longevity of the correction with stem cell therapy and what it actually is doing at the cellular level of rebuilding the tissue is what got us so excited about just what it could mean for each and every person,